All right. Good morning, good afternoon, good evening. This is Dr. Garais for BIO116, Anatomy and Physiology 2. This is cardiac. Now, this is the Anatomage. And how did we get to the screen? We, of course, went into the main menu and got the functional anatomy. I forgot what it's called. Yes, it's called functional anatomy. And we opened up cardiac. And of course, it's heart beating. Know your waves, PQRST. What do they mean? Know normal heart rate, 60 to 100 beats per minute. Less than 60, bradycardia. Greater than 100, tachycardia. And you can see here, this is called NSR, normal sinus rhythm. You'll see the distance between the R waves are pretty even. So that's how we can say it's NSR and it's normal. All right, the anterior view of the heart, I labeled right here the right atrium. But how do we know? Well, if you notice, you have the superior vena cava and the inferior vena cava leading to your right atrium. If that's your right atrium, this has to be the right ventricle. This, of course, is the aortic arch because you could see the three tributaries there, and that's your carotids. Be able to identify what these structures are. Those are, of course, your coronary arteries and veins. These are all external structures. Of course, the apex and where all the great vessels are, that is the base of your heart. If we turn the heart around, be able to remove certain structures. And we, of course, use this button right here, invisible lady tool, also known as your explore tool. I press on that, and then I'm removing the descending aorta. As you can see, it's part of the aortic arch. The descending aorta goes behind the heart. These are now the pulmonary arteries and veins. As you can see here, we'll label them in a minute. So if the other side was the right ventricle, this has to be of course, the left ventricle. Oopsies. Let's go back. This, of course, has to be the left ventricle. Left atrium. If you notice the left atrium, you have a left and right pulmonary vein, since that's coming back from the lungs to the oxygenated side. And if you recall the pulmonary trunk up here, that also goes into a left pulmonary artery and right pulmonary artery. Okay, and here is your coronary sinus right here. That is the large venous structure, part of your coronary arteries, going into your middle cardiac vein, which is right here, which is the large coronary artery in the posterior section of your heart. And you can see it's posterior because, of course, the pulmonary arteries are here and the coronary sinus is here. And you could also see here that the middle cardiac vein in your posterior interventricular sulcus is here. Posterior interventricular sulcus separates the left ventricle here from the right ventricle here. If you have a posterior interventricular sulcus, you also can see that there's an anterior one. Right here. All right, those are internal structures, of course. Sorry about that. Of course, the right ventricle right here leading into your pulmonary trunk. Let's look at some valves. I have your right atrium here, right ventricle here. Of course, the AV valve's got to be right here in the middle. So I could cut this, use this tool, right, our clipping tool, already selected. All right, we see several valves here. This one, obviously, it has the chordae tendineae. Therefore, that has to be an AV valve, right? And if it's on the right side, that has to be the tricuspid. If you see here, these are semilunar valves. This coming off the right ventricle, this has to be the pulmonary semilunar valve. And this, of course, coming off the aorta, here, that's got to be the aortic semilunar valve. All right? And those are the structures that you need to know of the heart. This is BIO116, Anatomy and Physiology 2. I'm your host, Dr. Garais, and these are the structures of that you should be responsible for your gastrointestinal tract. Let's do the easy ones first. Your esophagus or food tube, your liver with your falciform ligament right there, and of course your stomach. You have a little bit of your gallbladder peeking out here anteriorly. All the fat here is part of the greater omentum. We remove that using our Explore tool. We also remove the fat around the area as well. Now that will reveal certain structures anteriorly. The two last parts of your small intestine, which are your jejunum here and your ileum here. Your ileum is then connected to your large intestine, cecum, first part. The ileocecal valve is between your small intestine, ileum, and your cecum here, hence the term ileocecal valve. This thing right here, that's your veriform appendix. That's that little thing from your cecum that's sticking out. It is a vestigial organ. It serves no real purpose, but it can cause problems when it becomes inflamed in appendicitis. You have your ascending colon here. Notice the haustra or the outpocketing. Your ascending colon here will have a flexure. That means it'll turn. And the turn here to go through your transverse colon. Let's go through your ascending colon again. It's unclear. I think I labeled it. So ascending goes up. Then you have a flexure, which is your hepatic flexure. Then you have your transverse colon here, which goes across. Then you have your, oopsies, what's going on? What did I just touch? Alrighty, let's edit that part out. Okay, we're back to normal. Right, I think my belly is in the way. So, since you had a hepatic flexure before, you have your splenic flexure here from your transverse colon, then to your descending. If you look behind it, that's your sigmoid, and then the last part is your rectum, leading to your anus. Your anus, you have two types of muscle: skeletal on the outside, which is this part here, and on the inside, that's your visceral. You can control your skeletal, you cannot control your visceral. So if we remove all these parts to get at the lesser omentum and the other, so we use this tool. Let's remove some of these things. And remember, this patient died of gastric CA. So let's look at all the inferior structures here. Let me get rid of some of this extra. So if we look at these structures here, that glossy appearance that you'll see all over here, that's your lesser omentum. Let's remove that. And then what structures can we see better here? Of course, your gallbladder that was peeking out before. And we look at this structure right here, that's your pancreas. The head of your pancreas swivels all the way around here, and it connects into your stomach, and we kind of remove the duodenum, which is right here. And the duodenum can only be seen in the undercarriage or the posterior surface of the stomach and the liver. So pancreas, gallbladder, of course, the rest of the stomach. And if we're looking at the stomach, on the bottom here, that's your pyloric sphincter. And then on the top, it's here. If we're looking over here, why is it so difficult? If you're looking over here in the backside, the connection of the esophagus right here into your stomach. And that, of course, is your lower esophageal sphincter, also known as your cardiac sphincter. And those are the let's get them all back. And those are the structures of your gastrointestinal tract. All right. This is BIO116. This is Dr. Garais, your instructor. And let us look at some of the responsible structures that we have. Excuse the video. I forgot to, might be a little bit janky. I forgot to bring my my handy dandy stand. But let's look at some certain structures. Pan back a little bit. Of course, you have, when you're looking at this, you're looking at the right lung and the left lung. You could see that the left lung has a superior lobe and an inferior lobe. And this area right here is your cardiac notch. But the right lung, let's get rid of this arrow thing. The right lung has a superior, middle, and inferior lobe. So 3 lobes on the right, 2 lobes on the left with a cardiac notch. Of course, that's your trachea. Your trachea has the carina right here, which is that bifurcation. This area right here, where it splits off into the left and right mainstem bronchus. If you notice the right mainstem bronchus right here, they have, it's shorter and more vertical. Therefore, foreign body will fall into the right lung a little bit easier. Both the right and mainstem bronchus connect into the hilum. You see all these dark holes right here. That is the connections for your pulmonary artery and veins. And here's the other carina here on the left side. You'll also notice cartilaginous rings only on the anterior of your trachea, because if you look at the posterior, there is no cartilaginous rings, so that the esophagus, which is your food tube, can expand. And of course, let's look at your, I'm trying to do this with my non-dominant hand without a gimbal. So let's look at this. You have here, of course, your cricoid cartilage. Let's look at that from the front as well. Here, your thyroid cartilage, that's the larger one. And of course, better seen in the posterior view, you have your epiglottis here, which will close off the trachea when eating or drinking. And that is your arytenoid cartilage there. Do know and understand that the deeper you go inside your lungs, this cartilage disappears, and with deeper into your lungs, at the level of your terminal bronchiole, you'll have all smooth muscle. And that's essentially your lung. Not too complex, very straightforward. And that's the worst we could do to you.